Medics at Cardiff University have discovered a new vaccine that treats diabetes type 1, the most rare form of the disease. The new medicine is administered via microneedles into the surface of the skin. It then switches off the immune system that destroys insulin-making cells, which is the genesis of diabetes type 1. This new advancement will mean patients won't need to take up to 3 insulin injections every day.
Well, the numbers are staggering as they are traveling. Here in Wales alone, 173,000 people are living with diabetes. In the UK, that number is 3.2 million people are living with diabetes. That's more than 1 person in 17 adults have diabetes. The World Health Organization says about 10% of the world is living with diabetes.
The number of people being diagnosed with diabetes continues to rise worldwide. Diabetes type 1 is what happens when the immune system destroys insulin-making cells in the body. Medics don't know exactly why this happens. The body needs glucose and produces insulin every time to deal with increased glucose in your body, which is turned into fuel. The immune system breakdown leaves patients unable to produce their own insulin. The medical remedy involves patients checking blood sugar every so often.
Then it'll count down and 11.2.
On this occasion, Emma Davis, living with diabetes type 1 for 13 years, has a sugar reading of 11.2. Her aim is to keep it at around 6. Like millions of other people living with diabetes, she will inject herself with insulin to compensate for the rising levels of blood sugar.
Well, it can be quite stressful. I think most of us try to not let it take over our lives, but we do have to remember that it is something that we have to look after and take care of. So if your blood sugar goes too low, so you've had too much insulin, you can have a seizure, you can go into a coma, you can pass out, all those kinds of things.
Researchers at Cardiff University have been working on a new vaccine that aims to deal with diabetes on a different scale altogether. The vaccine they have come up with switches off immune response that destroys insulin-making cells. The idea is that fragments of proteins in the pancreas are given back to the body in a way that switches off parts of the immune system.
And we've just finished dosing all of those. We don't know all the answers, but what we do know is that nobody phoned me in the middle of the night, which means that there were no major side effects from it. So it's definitely safe. Is it effective? We will find when we analyze all the results of the trial.
Researchers working on the project say the genes that cause diabetes are the ones targeted for switching off. What's more, the use of microneedles is a much easier treatment than the normal injections.
If we would be very optimistic, the idea is that we would then, like you would for smallpox, that you eventually eradicate the disease by treating everybody before they get it.
People living with diabetes will be hoping the tests are concluded soon.
Sounds really great. I think what they have now is you do 1 injection every 2 weeks. So even that's a better step up than multiple injections a day.
The vaccine is set for its 3rd phase, involving more patients in and out of the UK. The full testing program will take around 3 years. James Smart for Cardiff News Plus.